Good afternoon and welcome to our fall semester town hall meeting. At our last few meetings, we have followed a pattern. At our last few meetings, I have given a state of the school set of remarks, followed by Dean Robert Amler talking about the most recent data regarding the pandemic and offering some predictions for the coming weeks. And after that, you heard from the vice presidents and the deans and a few section directors, largely focusing on how we are responding to and managing the college through the pandemic. This meeting, we're going to do things differently, and you're going to see some old faces and some new faces. And in addition to seeing some new faces, here's some new voices about the state of the school. We're going to begin, as we have, with clearly the crowd favorite. When I get feedbacks on the town hall meetings, everyone's favorite is Dean Amler talking about the pandemic, analyzing the data, and telling us what he predicts will be happening in the coming weeks. So he will be our old face and our old voice back again. But you're going to hear from some new people this time. Beth Chaser is going to talk to us about what happened with the Days of Giving and plans for a virtual founders dinner. Sarah Cotta will appear again to talk to us about building sanitation and cleaning and self-attestation and the management of our property in the pandemic and how that is evolving with the governor's changing directives as the data changes in New York. Mille Etienne is going to talk to you about some of our campus-wide diversity and inclusion initiatives. You're going to have an update on the incoming students who are joining us this semester. On behalf of the dental school, Dr. Ed Farkas, the graduate school, Dean Marina Holtz, the Vice Dean of the School of Health Sciences and Practice, Ben Johnson, and for the School of Medicine, Karen Murray. Now, we have not asked people to send in questions in advance for this town hall meeting. We're going to invite you to send your questions in live while the meeting is progressing. Depending on the setup on your computer, either go to the bottom of your screen or the top of your screen where there's the icon for questions and answers, and go ahead and type in your question and I'll be able to see them. Available to answer your questions will not only be the panelists that you'll see in our formal presentations, but we will be joined for the question and answer period by Adam Hammerman, by Nick Janiga, by Ronnie Myers, and by Jerry Nadler. So they will be available for questions in addition to the panelists. Hope you enjoy our presentations for town hall meeting, and I will see you again after our panelists present to be your moderator for the question and answer period. Stay safe, everyone. Take good care of yourself, and I hope you enjoy our presentations today and have a solid, interactive, and productive question and answer period. Thank you.
I'm Dr. Robert Amler, Vice President for Government Affairs and Dean of the School of Health Sciences and Practice here at New York Medical College. I was asked to give you a quick update on the COVID situation. So far, over 5 million cases of COVID have been reported in the United States, and testing is more efficient than ever. So it's less of an artifact than it was when we started counting a few months ago. More than 50,000 new cases are reported every day, and that's about 1% a day being added to the total. And we are seeing 1,000 new deaths reported each day. So this is not over by any means. Now, New York and the Northeast have cooled off somewhat, and the distribution of cases around the country is very patchy. Some of the places we've been reading about have cooled off a bit in the last week, like California, Arizona, and Utah. But if you or a loved one found yourself in New Orleans or Memphis or Miami or Brownsville, Texas, you were in the thick of it. So New York keeps updating our list of quarantine states, meaning you are quarantined if you come here from 34 states and Puerto Rico based on disease rate criteria. Some places, like Louisiana, are kind of obvious. But Montana, which is on the list, seems hard to understand based on the data unless you happen to come from Bighorn County. Rhode Island was just added to the quarantine list, and Delaware and Washington, D.C. were just released, so you're okay if you've just come from there. Well, what's the big picture? Right now, we are still waiting for better pharmaceutical leverage against this virus in the way of specific medications and a safe and effective vaccine. Meanwhile, the non-pharmaceutical, low-tech solutions are the best tools we have, and they still seem to help considerably. I've been speaking often of the 4 W's. Wash your hands, wear your mask, watch your distance from others, and walk away if you're sick. Stay away from sick people, stay home if you're sick, and stay on quarantine when you're told to do so. Because we're all in this together, and with a little cooperation, we will safely reopen this campus as events permit. Thank you, Dr. Halper.
Hi, everyone. My name is Beth Chazor, and I am the Chief Development Officer and Executive Director of Alumni Relations for New York Medical College. I want to talk today briefly about philanthropy. As many of you know, colleges and universities across the country rely on philanthropic support for scholarships, endowments, research, and general operating needs. New York Medical College is no different, and especially in light of the current COVID-19 situation, which has greatly impacted all our lives, donations are needed now more than ever to support our students and important student scholarships. Toward that end, we held our 3rd annual Days of Giving campaign on June 9th and 10th. Over those 2 days, we raised over $500,000 for student scholarships. We're so thankful for all who participated in these efforts. We are also hosting our first ever virtual Founders Dinner on Wednesday, October 21st, celebrating some incredible honorees and highlighting the college's response to the COVID-19 crisis. It'll be an entertaining event with some exciting guests, including a conversation with Yankees Hall of Famer Mariano Rivera and his wife, Clara, who'll talk about their own efforts in the community during COVID-19. We hope you'll join us for this unforgettable event. Please mark your calendars again for October 21st at 5:30 p.m. These are challenging times for sure, but with your help and support, we'll continue to do great things together. Every gift matters, no matter the amount. So it makes a big difference to our students. We hope you and your family are staying safe and healthy, and we thank you again for all that you do.
Hi, I'm Sarah Cottet, Executive Director of Facilities Management and Environmental Health and Safety. I've been asked to speak today about how we continue to keep our campus safe. Our plan to do so has 5 main facets. Facet number 1 is that we require all individuals to wear a mask whenever they're in common areas or when 6 feet of social distancing is not possible. Please remember that a mask should always cover your nose and mouth. All students and employees are provided with 2 reusable cloth masks. Individuals who need their initial mask allocation or who require replacements should contact the stockroom at nymc_stockroom@nymc.edu. Facet number 2 is ensuring that everyone can practice good hand hygiene by ensuring that all hand washing facilities are amply supplied with soap and paper towels, and that everyone has easy access to hand sanitizer. Facet number 3 is ensuring that we can maintain 6 feet of social distancing and controlling our total campus population density such that it does not exceed 50% per New York State requirements. Facet number 4 is requiring the completion of daily health attestations by every individual who enters a campus facility. And finally, facet number 5 is the enhanced cleaning and disinfection of all patient care, teaching, common, and other high-touch areas with EPA-listed disinfectants throughout the day. All spaces that are cleaned are logged per New York State requirements, where and when appropriate, we also may use electrostatic sprayers. For shared surfaces or areas with shared surfaces, such as the library and cafeteria, we've provided EPA-listed disinfectants in spray bottles and paper towels such that individuals can disinfect surfaces before and after use. As usual, please feel free to reach out to me or to any member of the facilities or EHS team with any questions or concerns. Thank you.
I am Dr. Mil Etienne, Associate Dean for Student Affairs at the NYMC School of Medicine. I graduated from New York Medical College in 2002 and went on to do my neurology residency at Columbia University, where I also completed a fellowship training and a master's in public health. I am now a neurologist specializing in epilepsy and brain injury medicine. I work for Bon Secours Neurology, part of the Westchester Medical Center Health Network. I also see patients at Good Samaritan Hospital, and I staff the neurology resident clinic at Bradhurst. As you know, in recent months across the United States and around the world, many have been protesting the many injustices against people of the African diaspora that have existed for far too long. We have been urged to say the names of victims such as Ahmaud Arbery, Breonna Taylor, and George Floyd. This last murder really hit home for me because I grew up next door and I have been very good friends with Sharon and Andrew Floyd, beloved first cousins of George Floyd. Our hurting community has spoken out and have been joined by decent people everywhere to stand up to these injustices. These protests have made their way to the halls of the ivory towers, and we have found that there has been increased interest in education and research regarding health disparities. At the same time, the importance of diversity, inclusion, equity, and belonging has risen to the forefront of consciousness of students and faculty at academic institutions across the country, including here at NYMC. The data is clear that people who have a sense of inclusion and belonging have better performance at work, stronger performance in school, and better health outcomes. Part of our mission here at NYMC is to make sure our graduates are best equipped to provide healthcare to the increasingly diverse communities in the United States. In order to understand health disparities, one must understand the impact that racism, sexism, religionism, homophobism, transgenderism, classism, xenophobism, and many other isms have on the practice of medicine. We will teach our students to combat this negativity with what I like to call the good isms. That includes professionalism, altruism, and humanism. It is worth noting that NYMC has an unusual history in this area. Our School of Medicine began admitting women within 3 years of our founding, and a Black woman was the valedictorian of the class of 1870. Our School of Medicine established a scholarship which could only be awarded to a Black medical student in 1928, and the first recipient was a woman. A few years ago, our School of Medicine had the highest percentage of URM students of any historically majority school in the US. We are very proud that our clinical teaching takes place in hospitals and clinics which serve a diverse patient population, with a significant amount of patients from underserved communities. We cannot, however, rest on our laurels. I will now briefly outline some of our efforts to build upon our history and move forward. We are piloting a course for faculty members on multiculturalism in medicine. This is a semester-long course that will go over key principles with faculty, including the role of implicit bias and microaggression in patient care, in interaction with colleagues, as well as interaction with students. This includes going over implicit bias in grading and techniques to make all students feel that they belong in your classroom or your clinic. In this day and age, it has become quite clear that it is not enough to not be racist, but rather it is important that we are anti-racist. To that end, the medical school has established an anti-racism and bias in medicine task force that is assisting the Education and Curriculum Committee to develop and incorporate more meaningful changes to the curriculum at NYMC, particularly with regards to creating a more inclusive environment. These changes will be instrumental in allowing us to lead the way when it comes to diversity and inclusion medicine and healthcare. We are offering an online course for our students called Finding Your Voice. This will teach students the fundamentals of how to craft an op-ed article for the popular press and therefore make their voices heard in the national dialogue. Thank you to Jennifer Reichert for leading this effort. We recently welcomed a new class of students to NYMC, and as part of that welcome, we had all the students go through implicit bias and microaggression training. This type of training is not a one and done, but rather will need to be ongoing throughout the 4 years of medical school. This very important training was spearheaded by the leadership of the NYMC chapter of the Student National Medical Association in collaboration with the School of Medicine Office of Student Affairs. Thank you very much to all the students who stepped up and provided this important training to the M1s. We have worked with Ms. Marie Asher, the director of the Health Sciences Library, to create a journal club where we will read books related to health equity, diversity, and inclusion, so that members of the NYMC community who are interested in having a deeper dive into this area will have that opportunity. The first book we will be reading is entitled How to Be an Anti-Racist by Ibram X. Kendi. NYMC leadership is working diligently to establish a more robust Office of Diversity and Inclusion for the NYMC campus. And we are working with student groups on the campus to make sure that we are providing the appropriate services for our students who are underrepresented in medicine. I am pleased to inform the campus community that Dr. Yvonne Thornton has joined our team as a student mentor and advisor. Dr. Thornton was the first Black woman to be board certified in maternal fetal medicine in US history. If her name sounds familiar to you, it may be because her autobiography, The Ditch Digger's Daughter, was featured on the Oprah Winfrey Show. We hope to announce additional personnel hiring soon. Additional efforts include reaching out to our alumni who are underrepresented in medicine so that we could foster a stronger connection between those alumni and our current students. Lastly, it is well established that the doctors who are most likely to provide care to underserved communities are the doctors who are underrepresented in medicine. In order to make sure we have more physicians serving these vulnerable communities, we are also focusing on the pipeline to get more URMs into the health professions. We are working with student groups to mentor both high school and college students to expose URMs to the various health professional fields, and also helping them to increase their competitiveness to apply for admissions. We have many other plans, but I just wanted to share a few key initiatives with you so that you can know that NYMC is fully committed to taking the steps to make our environment more diverse, more inclusive, and to make sure that everyone who is part of the NYMC community understands and feels that they belong here. Thank you for your attention.
Good afternoon. My name is Edward Farkas. I am the Vice Dean of the Touro College of Dental Medicine. I want to start by thanking Dr. Halpern for inviting me to participate in this town hall. I'm honored to be here, and I've been asked to give an overview of the admissions process and to speak a little bit about our new D1 class. In Yiddish, we use the word shidduchim to describe a system of matchmaking. Though the endpoint we are trying to achieve in the dental school admissions game is not matrimony, the process is somewhat similar. The admissions committee and its staff have created a procedure that solicits applications from a diverse set of students who come from all over the country and all over the world. They then try to see which students would be a good fit for the class we are assembling. At the same time, the applicants try to figure out if the education and educational environment that the Touro College of Dental Medicine provides is in line with their expectations and their concept of what the dental school experience should be like. If the expectations of the student and the expectations of the school meet, we have a shidduch, a match. What are the students searching for? A post-matriculation survey given to the recent entering class illuminates some of the main themes. Students want a rigorous education that will train them to be high-level practitioners when they graduate. They want to undertake this training in a collegial, supportive atmosphere, and they want to have a facility and the faculty that is technologically up to date and will support the teaching to its maximal potential. We have always provided these items in the past, and we will continue to do so in the future, even with the adaptations needed to protect the health and safety of the students, faculty, and staff. What is the school looking for from the students? The mission statement of the Touro College of Dental Medicine at New York Medical College is to graduate outstanding dental professionals who will utilize a complex knowledge base and sophisticated perceptual skills to deliver excellent healthcare service to their diverse communities with integrity, compassion, and empathy. We are looking for students whose undergraduate record, standardized test scores, and life experience speak to the great possibility that they have the potential to meet all of our mission statement goals. It is as simple as that. We work hard to recruit superior students who have the drive and spirit to become leaders of their class, leaders of their profession, and eventually leaders of their communities. The recently released matriculation survey will be very helpful in informing us as to what potential students actually think of the school and how we can tailor the program to meet their expectation and achieve a message that will resonate with the majority of applicants. Again, more matches. As they say, customer service is everything. And recruiting the right students is vital to the lifeblood of any school for two major reasons. The first is that while students are on campus going through the program, they are the ones that determine the atmosphere and spirit of the school. Having the proper level of each can greatly affect the learning as well as the school's ability to succeed in its mission. The second important reason for recruiting the proper type of students is that they will represent us going forward. If they succeed greatly, we will be viewed as a success. If the opposite happens, the blame will be laid at our feet. And for the class of 2024, we have had approximately 3,494 applicants, with 2,581 of them fully completing their applications. We selected for interview about 505 applicants, from which we assembled a class of 114. These students came from 18 different states and multiple foreign countries. They represented 74 separate undergraduate colleges, and 13% of them were underrepresented minorities. 41% of them are female, and the median age of the overall class is 24 years old. Academically, their average dental admission test score was 21.2, and their average overall GPA was 3.46. Their orientation to the D1 class was delivered virtually, but they did show up on July 9, 2020 in person 25% of the time for loop fittings and scrub distribution. Their didactic coursework is currently being delivered by Zoom. Some of it is synchronously delivered, some of it is asynchronously delivered. But their dental anatomy and occlusion course, which is their first opportunity to develop hand skills, is being given in the SimLab in person. The students are socially distant, wearing masks, and limited to 25% of the class at a time. But overall, it is the same course that was given to the class before them and the class before them. They seem happy about being able to come into the building, and like all of us, are hoping for the day that the pandemic will be behind us. Thank you for taking the time to listen. I hope I have shed some light on the admissions process and the makeup of our new D1 class. Thank you.
Hello, everybody. My name is Marina Holz, and I am the Dean of the Graduate School of Basic Medical Sciences and Professor of Cell Biology and Anatomy here at New York Medical College. I would like to give you an update on our incoming 2020 class of PhD and master's students. I'll begin with describing our new PhD class. I'm very excited that we have 8 students starting this year, and I want to thank all of our students for trusting us with their education and knowing that we can provide a safe environment with the same high quality of instruction that we always have. In terms of our admission statistics, we had about 20% increase in applications over the previous year. We are much more selective in our admissions process. And as I said, 8 students decided to come here, and that's about 10% increase in the yield, which is the number of enrolled students that decide to come to us compared to previous year. In terms of the profile of our admitted students, the GPA of the students was 3.54, which is very impressive. And in terms of their other qualities, a quarter of the students were Black and Hispanic, and we're very excited about the diversity of this class, with about 2/3 of them being female. For our master's program, we have several master's programs. I will start first with our 2-year master's program in the basic medical sciences, as well as the 6 basic science disciplines. We had the record number of applications, about 20% increase over the previous year. And we were much more selective than the previous year as well. And the number of students that are coming to us this year is 89, which is about 10% increase over the previous year. In terms of the profile of these students, their GRE was 150, which is slightly below the average national of 153. Those who provided us with their MCAT score, the average was 499, which is in line with the mean national MCAT of 500. And those who provided us with their DAT score, that was 18, which I think is right about average nationally as well. In terms of the demographic of this class, about 20% of the incoming students are Black or Hispanic. And again, we thank them for choosing NYMC. They come from a variety of undergraduate colleges across the nation and abroad as well. And we're very well represented in many states, but also here in the New York area. Another program that I would like to mention is our one-year accelerated master's program. For this program, we accepted 28 students that are coming to us this year. We're much more selective. We had a 41% increase in applications compared to last year. So I want to thank the admissions committee that worked very hard to review these applications. They provided their MCAT scores, and their score was about 508, which is above the national average of 500. And about a quarter of the incoming class are Black or Hispanic, and the variety of undergraduate colleges attended spans the nation. Finally, I would like to say a few words about our Clinical Laboratory Sciences Master's Program, which is our newest program that enrolled its second cohort this year. We are enrolling 9 students. Our maximum in this program is 10, so we're very excited that these students chose to come to us, and we are one of the 3 programs in New York State that offer this program. So it is very unique. In terms of the diversity of this class, again, about a quarter of the class are Black and Hispanic, and most of the students come here from the New York area, although some come from other areas of the country as well. So again, I thank you for your attention, and I hope you will help me in welcoming our new students to campus when it's safe, and also online. And I would like to thank all the admissions committees, all the members of those committees, the program directors, and I want to thank our wonderful faculty that will continue delivering our instruction online and in person when applicable. Thank you very much.
On behalf of Dean Robert Ambler and the entire School of Health Sciences and Practice faculty, staff, and administration, I'm Ben Johnson, Vice Dean of the school, and I thank you today for tuning in to this town hall. Firstly, I want to thank all of our dedicated students who, like us, have rolled with the punches of this unprecedented public health challenge we are facing. The students, just like our faculty, are eager to return to the classroom for face-to-face instruction and clinical experiences, but realize, just as we all do, the precautions we must take in order to keep us all safe and healthy and to bring this pandemic under control. So a big thanks to the students for their patience. Secondly, I want to recognize the yeoman's work that our Office of E-Learning has done for SHSP, and particularly the faculty and students, in ensuring the integrity and quality of our online instruction. Associate Dean Denton Brocius and his staff have remained on top of things to keep us all working effectively and efficiently. Thirdly, kudos to all of our SHSP faculty led by their department chairs, Mike Majak in physical therapy, Mark Kittleson in public health, and Kate Franklin in speech-language pathology. The faculty, while rolling with the punches, have been responsive and innovative in reorganizing their curriculum, course offerings, and individual classes to accommodate our instructional needs and to ensure quality instruction for our students. Of course, one of the biggest challenges has been in offering practicum and clinical experiences, as we are required by our accrediting agencies, and which are a vital aspect of what we do in SHSP. Those faculty members that lead those efforts have been working outside the normal box of operations to ensure that we can meet these challenges and to provide our students with hands-on experiences that they need and expect. I'm pleased to tell you that we have just finished one of our best summer semesters ever, with enrollments that are near our all-time high in public health. With regard to the fall 2020 semester, our physical therapy and speech language pathology enrollments are at full capacity, and we are particularly excited at the high academic credentials the incoming classes come to us with. And in public health, we expect to exceed our enrollment goals across all program areas, as we presently are at about 95% of our budget goal. And we still have 2 more weeks of active registration taking place. And this is typically our busiest registration time. I'm also very pleased to say that we have an incredibly diverse group of students across all programs, and particularly a large number of international students in our public health programs. Physical therapy will operate in the fall semester with a combined online and in-the-lab instructional program. Lecture-based didactic experiences will take place in an online format, while all laboratory experiences will be in person in our highly modified lab spaces and with appropriate social distancing and PPE as required for safety purposes. Outside clinical experiences are arranged with our external partners and will follow all precautions required by both NYMC and that particular partner organization. Public health is operating under a combination of fully online asynchronous course model and a hybrid model wherein both synchronous online and in the classroom experiences will be offered. Those students enrolled in practicum experiences will be engaged in real-world public health learning experiences using a combination of distance and in-person experiences, depending upon the nature of the project and the requirements of the agency with which the student is engaged. Lastly, speech language pathology is working under an online model of instruction, which is largely synchronous in nature. Students are utilizing telehealth significantly for their important clinical experiences. Our own campus speech language clinic will soon be open on a limited basis and with full health precautions followed. Students will be engaged in supervised clinical experiences through this clinic. SLP is also working with our external partners on other clinical experiences for their students, and as circumstances allow, these external experiences will be safely expanded. As for the spring 2021 semester, all of us in HS and SHSP are hopeful for a full return to normalcy of operations. We will keep you informed through the usual channels as the fall semester progresses. So thank you for tuning in today.
My name is Dr. Karen Murray, and I'm the Associate Dean of Admissions for the School of Medicine here at New York Medical College. I'm also a proud graduate of the New York Medical College class of 1999 and of the Metropolitan Westchester Medical Center OBGYN program class of 2003. I currently practice at Open Door Family Medical Center in Austin and at Phelps Hospital in Tarrytown. Today, I'm going to give you an overview of the admission cycle for 2019-2020. I wanted to give you a little bit of background before we get into the details. And just to let you know that New York Medical College is ranked number 8 in the nation with the number of applications we received yearly. We also are number 1 in New York State for the number of applications we received. And for the past 4 to 5 years, greater than 50% of our applicants have been female. With that information, I wanted to get into more details of the actual class of 2024. For the 2019-2020 cycle, we had over 12,000 applicants and approximately 11,000 completed applications with CASPER. We invited 1,416 applicants for interviews, and we interviewed 989 applicants. We offered 463 acceptances for a class of 212, giving us a yield of 46%. When we looked at the yield over the last 10 to 12 years, we see that in the early years, we were in the high 20%. In 2013, we crossed over into the 30th percentage. From 2013 to 2019, we remained in the high 30th percentage. In 2019, we crossed into the 40th percentage, and I'm proud to say that for 2020, we remain in the 40th percentage with a high yield of 46%. As we look through the national data, I wanted to give you an overview of the last 3 application cycles. from 2017 to 2020. In overall applications, the average MCAT score was 504 in 2017-2018 cycle, and it gradually increased to 506 in the 2019 to 2020 cycle. For matriculants, the average MCAT score in 2017-2018 was 510, and that also gradually increased to 511.5 for the 2019 to 2020 cycle. In looking at our own class, as we compare to the national average for the last 2 years, for the 2018 to 2019 cycle, the average MCAT was 511.2, and for our class, it was 511. In 2019-2020, the national average was 511.5, and you can see for New York Medical College, our average was 512. This makes our class just about average in terms of matriculant metrics. When you look at we wanted to also take a look at the demographics for the 2019 and 2020 class. We see that there was an increase in the number of New Yorkers from the 50th percentile to the 53rd percentile. We also had an increase in the underrepresented in medicine from 16% to 20%, and for the alumni from 5% to 8%. For faculty from 2% to 4%, and there was a slight dip in women from 56% to 54%, but still above the 50th percentile. When we looked at the underrepresented in medicine for the class of 2020 to 2024, we saw that for the class of 2020 and for 2021, we were in the high teen percentile and dropped down to the 10th percentile for the class of 2022. This we attribute to the major changes in the admissions department, which occurred just prior to that 2022 class. We quickly rebounded, and for the class of 2023, we made it back to the high teen percentile. And now for the class of 2024, we're into the 20th percentile. So an overview of the fact sheets for the class of 2024, there were 12,143 total applicants. We had about 1,000 applicants interviewed for the class of 212. 54% of the class is female, and the students come from 21 different states. We also have 6 international students. 53% of the class is from New York, and the class represents 96 undergraduate schools. The average age of the class is 24 years, and there's 8 members of the class with alumni legacy. And again, a 46% yield in our acceptance. Thank you.
Thank you, Dr. Murray, and good afternoon again to everyone who may have joined us after I welcomed everyone. We've had several questions come in for our panelists and for those who haven't been speaking as panelists, but who were listed on the broadside as participating. Our first question has come in, goes to Dean Robert Amler. Dr. Amler, can you please explain the difference between an N95 mask and a cloth mask? I certainly recognize the obvious differences, but I want to know in which situation is one type appropriate and in which situation is another type appropriate. I've also heard that there is a problem with counterfeit N95 masks. Can you tell us about that, please?
Sure, and thank you for the question. Remember that the N95 really is a respirator. It is extremely tight and has to be carefully fitted around the curvature of your face so that nothing gets in between the edge of the mask and your skin. This keeps material from getting into your nose and mouth from the surrounding area in which you may be working or walking or what have you. In other words, the N95 is there to protect the wearer, that's you wearing the mask, the respirator, against infected material coming your way. Its use is restricted to people who've been trained in its use and have been fitted in its use, because simply slapping it on your face does not provide you with the right amount of protection. Because it's also a more expensive piece of equipment, it is generally restricted to people working in healthcare settings, physicians and nurses and others who are in the midst of atmospheres that are contaminated with virus particles, or at least potentially contaminated. The cloth mask, or sometimes the paper surgical mask, is a different type of apparatus. This is designed to stop the exhaled droplets from your own nose and mouth from getting out into the air around you, where it can infect other people. So the N95 is there to protect you. The surgical paper or cloth mask is there to protect everyone around you from you. But it's also true that when you wear the cloth or paper mask, you are giving yourself a good level of protection, at least from the immediate or large droplets that could be headed your way. Now, the other part of your question is which is more appropriate? Well, again, the N95 is really for healthcare providers, certain first responders, and others who are at imminent risk of exposure because they're going into scenarios that bear infected material. The other type of mask is really for all of the rest of us, going around, going shopping, being in crowds, traveling, and going to work and so forth, because this will protect not just people around you, but the airspace in which you're working. Finally, there is such a thing as counterfeit masks. You need to know where you're getting your masks, making sure that they're reliably manufactured. The N95s are the most susceptible to counterfeit, and I'm no expert on the manufacture of these things, except that you do need to make sure they come from a reliable source. If there's more time during the session, perhaps Sarah Cottet can say a word about how New York Medical College has been sourcing the masks, the respirators, the small number that we have been able to obtain. Thank you.
Thank you, Dr. Amler. Our next question has come in for Dean Ronnie Myers of the dental school. Dr. Myers, what types of patients are being seen in the dental clinic right now? Are you accepting all new patients or only certain types of new patients? Dean Myers.
So first, thank you for the question. Right now, we are accepting all patients. In fact, as Dr. Farkas mentioned, as far as capacity is concerned, our clinics are at about 50% capacity, given our social distancing requirements. But we are accepting all new patients as need be. There are no requirements as to types of patients. We accept children, adults, special needs, and those with other oral health care problems. So totally open, and we accept all. Thank you.
Thank you, Dean Myers. Our next question has come in for Dr. Karen Murray. Dr. Murray, you described something called a CASPER. What is that, and what is it supposed to measure?
So the CASPER is a computer assessment for sampling personality characteristics. And since the medical school has begun its holistic review, we've used the CASPER to assess personal traits of our applicants. So it looks at things like professionalism, ethical grounds, empathy, compassion, and we use that as an integral part, or the third component in the application assessment for all our applicants that apply to New York Medical College.
Thank you, Dr. Murray. We've got two more questions which have come in. It seems like the most popular continues to be Dr. Amler. This one is for Dr. Amler and for Sarah Cottet. So we'll have Dr. Amler go first. Dr. Amler, what do you think of these devices which allegedly filter the virus out of ventilation and air conditioning systems in our buildings? And Ms. Cottet, do we have any plans for installing these systems in our buildings? I think we should start with the big picture with Dean Amler first and then go to Ms. Cottet. Dr. Amler.
Yes, well, filtering systems work. They filter particles in the air. And there are also electronic means to disrupt infected particles that may be circulating that use, for example, ultraviolet light. There are even some LED patents that are coming out that use a different type of bulb, but it's the same basic principle to either attack the organism with specific energy fields or to just physically trap the particles, keep them from getting into the air. So we know that filters filter. The question is, do they adequately clean the air, in this case, cleaning out the COVID virus, the SARS-2 virus, to make sure that the air you're breathing is free of that virus? Sarah may have some more specific information on what we've learned works and doesn't work.
Thank you, Dr. Amler. Thank you, Dr. Halperin. So with regards to what we have implemented at New York Medical College, we had previously been using a type of high efficiency filter known as MERV 14s. This is standard utilization. We haven't changed. And equally, this is a higher filter rating than suggested by Governor Cuomo in his briefings over the last month. Just please keep in mind, though, that COVID transmission occurs through droplet transmission. And the most important means that we can use to prevent infection are wearing an appropriate mask over one's nose and mouth, practicing good hand hygiene consistently, and practicing social distancing.
Thank you, Sarah. I'm impressed at how quiet our audience is today. We have over 170 people tuned in, but there's plenty of room for more questions. We do have another question which has come in. This is once again directed to who appears to be the star of the show, Dr. Robert Amler. Dr. Amler, can you comment on the recent study from Duke University, which asserts that so-called neck garters or bandanas are ineffective as face coverings? And if you think that study is valuable, should we not permit them to be used on our campus compared to more standard masks, or do we need more data on the subject?
Well, always good to get more data, and there are so many different studies coming out, some peer-reviewed, some not peer-reviewed, some from highly reputable sources, some not so much. I don't recall that specific study from Duke, although I did see, thanks to Dean Nadler in the medical school, this issuance from the Association of American Medical Colleges, the AAMC, which convened an expert group reviewing what is currently known about mask wearing. They conclude first and foremost, just as Sarah said a minute ago, the key is to be wearing an effective barrier over your face so that your exhaled breath does not contaminate the space around you with any kind of microorganisms you could be carrying, whether you know you're sick or not, whether you feel sick or not, and whether it's COVID or not, to keep the airspace around you as pristine and clean as possible for the protection of your fellow travelers as well as you yourself. So, the wearing of a mask is the ideal scenario, along with the social distancing and everything else we've talked about. Now, the double layer cloth mask, and some are triple layer. The double layer, the triple layer, the paper surgical mask, these are the ones that have been best studied and are clearly effective in reducing the spread of the virus. There was a study, I don't know if this was Duke or someone else, that was done on the USS Theodore Roosevelt, the aircraft carrier that you may remember back last spring had this very remarkable outbreak of COVID among the shipmates who were aboard that aircraft carrier. And it appears that the wearing of masks was effective in preventing infection among those who were wearing masks. And that shows that even the wearing of a non-N95 device can be protective. So that's important. Now, a neck garter, I'm not sure I would recognize one if I saw it. I don't know much about those, but if it's hanging around your neck, I don't really see what that's doing to prevent emission of droplets. Maybe it's partially covering your mouth, I'm not sure. But clearly you need that mask to be covering your nose and your mouth. And I've seen far too many people walking around with masks that are drooping and sagging. And I know that many people do get a little winded and dizzy when they have that mask up too close against their, I won't say too close, but appropriately close around their nose and mouth. But the fact is, if it's not a little uncomfortable when you're wearing it, you're probably not wearing it correctly. If you get dizzy, find a place where you can step outside for a while, or step into a stairwell or some other large ventilated space. You can take the mask off for a minute or two, breathe some more air, and feel better. Thank you for the question. Very important one.
Thank you, Dr. Amler. I believe we probably are both dating ourselves. I believe the question was referring to a circular device that goes around the neck that would keep one's neck warm, but then some people are pulling them up to use as a mask, neck garter, or neck gaiter, they were called.
So in this case, you're talking about trying to block exposure from your nose or mouth into the air around you. That's the physical principle. Whether or not that does it effectively is going to depend on how you wear it and what the dimensions are. Thanks.
Our next question goes to Dean Jerry Nadler of the School of Medicine. Dear Dean Nadler, can you describe what's going on in the School of Medicine for online versus in-person education? And what's going on, please, with the clinical rotations in hospitals for our students?
Thank you, Dr. Halperin. It was an excellent question. And as all leaders of educational institutions these days, it's a challenge. Things can change. And I first want to thank our faculty, our staff, particularly the educational and IT staff and deans, for working with our students. So I'll start with our clinical years, the 3rd and 4th year students. The good news is, as many of you know, in New York, we have a low infectivity rate compared to when we were in the midst of the terrible high rates in the pandemic, when we had to pull our students from clinical rotations. Fortunately, our 3rd year students are back at rotations in both their electives and their core rotations this year. And our 4th year students, which are now applying for residencies, are back on their clinical rotations. So that's good news, and we have wonderful hospitals, wonderful clinical educators that are working with them. The only challenge to our students, particularly the 4th year students, is because of the national pandemic and travel restrictions, our students can no longer do away rotations. And this is an unusual year, like everything is unusual this year and difficult. And that's an issue because these students are applying for residencies in many cases at institutions at other states. However, they are no longer able to do these rotations in person, and they're doing some virtual rotations. So that's the only difference, but they're back in the clinic, they're taking care of patients, and that's good news for our 3rd and 4th year students. Our preclinical students, we're doing mostly for safety of the students, safety of our staff and faculty, mostly virtual education, but we're using all the technology that's possible, such as Zoom, such as small groups virtually, and everything possible that we can do that way. However, some courses, as you can imagine, can't be done virtual. So we're having some courses, particularly for our M1 students, anatomy, done with spacing, social distancing, PPE, but they're actually doing their anatomy courses in person, and also some small groups for histology in person. In terms of physical diagnosis, the history part is done virtually. We will start to get back with PPE with in person. So we're doing whatever we can. We had a wonderful, Dr. Murray described our M1 class, which we're thrilled about. We did a wonderful orientation for our students. Most of it was virtual, but we also put up a large tent, and they met their house deans in person. So we're doing whatever we can for enhancing socialization, making the students feel welcome while trying to be as safe as possible. So all large lectures are done virtually. Most of the other lectures are done virtually. And the students seem to be doing fine with that aspect. Thank you.
Thank you, Dean Nadler. We have a three-part question for Sarah Cottet. Dear Sarah, what's the air exchange rate of the HVAC system in Skyline? Are we using carbon dioxide sensors to verify the parts per million? And how are things going with the elevator repairs?
Thank you, Dr. Halperin. To start, so for those who do not know what an air change is, it's the way that we measure how many times per hour a room would fill up with air given the supply for that particular room. So in a nutshell, there's a multitude of different kinds of rooms and spaces, and each typically has a specific air change range that's associated with it. So offices may commonly have 4 air changes per hour. Our dental clinic space has approximately 10 air changes per hour. We do not use tracer gases or carbon dioxide sensors to measure this, but we do a methodology called testing and balancing when we're constructing and renovating spaces, or when we think that we're having airflow issues. So that is a way of measuring the airflow in a space, and we can make corrections as necessary. The elevator repairs are ongoing. We hope to have partial restoration by late September, mid or early October. Obviously, COVID has presented some construction challenges, not in the least that construction teams also need to be able to socially distance. So that has slowed us down to some extent. Thank you.
Thank you, Sarah. Our next question has come in for Deans Amler, Myers, Nadler, and Johnson. So we obviously can't have 4 people answer at once. Let me read the question and then I'll divvy up how we'll tackle it. The question is, if the virus is not easily transmissible outdoors, is it necessary for students to wear masks outdoors while walking around the campus? Why don't we start in alphabetical order? We'll have Dean Amler go first, and then Dean Myers or Nadler or Johnson if they have anything to add. So Dean Amler, why don't you go first on that one?
Sure. I've been alphabetical my whole life, Dr. Halperin, so I'm used to it. Thank you. Here's the thing. You know, I both agree and disagree with the premise of the question. The question began with since the virus is not easily transmissible outdoors. First of all, I agree, and so does my former colleague, Dr. Tony Fauci, Dr. Deborah Birx. All of the experts agree that when you are outdoors in open air, the dilution of that open air is marvelous, and it keeps the virus from accumulating in any kind of concentration. But I also disagree, because even with that, if you are not social distancing, if you are not taking care of all the other precautions, washing hands when you touch things outdoors, there are poles and handles and other things that you could touch. So when you're outside, you're not completely safe from the virus. And even though your risk of being infected is far less when you're outdoors than when you're indoors and in a closed space, is that a justification to remove your mask every time you go out? Are you going to be talking to people? Are you going to be around? And so I would pose it this way. It's certainly better when you're outdoors. But for those of us on the campus, if we do get sick, even if it's not a major illness, it's going to require isolation, it's going to require quarantine, and we have an educational and teaching and service and research mission. And if we start getting people infected, even from relatively minor exposures, the stakes are that you have to quarantine, you have to isolate, and it's going to be disruptive to campus operations.
Okay, as Dr. Amler was speaking, we had another question which just came in. I'm going to try to summarize it. It's rather lengthy. The question concerns relying on attestation that I don't have a fever, that I'm asymptomatic, versus requiring people to have a negative COVID-19 test before coming back to campus. Now, the deans, the vice president spent a lot of time discussing this, and perhaps we ought to give Dean Amler a break. Maybe Dr. Nadler can summarize the conversations we had about whether we would be requiring people to have a negative test, and then the whole discussion about if you do that, how often do people have to be tested, et cetera, and how we, like most organizations, went to the self-attestation issue. Dr. Nadler, are you willing to tackle that one?
Yeah, I'll start. It's no straight answer. I'm on calls pretty much weekly and sometimes more often than that with other deans across the country in dealing with this. And you watch people, it's a very good question. And many of you have watched the news just like I have, and you see varied responses across the country. Part of the decisions that are made in some locations are the availability of rapid COVID tests where they can test people and get rapid results and get them back and retest people. Everyone should realize that the COVID test, and I'm talking about positivity test for having the virus, a virus particle, is only good for that point in time. And once you have COVID, it can remain positive for some time in shedding virus particles. So the testing is complex. The current tests that are available, and you also have heard this, the standard tests are taking, if you're lucky, you get results back in a day. Otherwise, you get back results 2 to 3, 4 days later. At that stage, it's not, as you heard Dr. Fauci say, it's not very valuable. The idea of getting a COVID positive test is being able to isolate that person or prevent that person from coming to campus. So under circumstances where we're concerned about a possible exposure or someone having COVID, they get tested. And then we keep them isolated until we get the result back. If the result becomes positive, then they follow policy and procedure for being quarantined and contact tracing. So we made the decision not to do testing for everybody, but do selective testing when the need arises based on evidence of some issues that might arise either by symptoms, people not feeling well, or some other areas where people are not following guidelines. So that's what we decided to do. And we're following the guidelines that are done by most of the schools in New York, in the majority of the schools across the country.
Thank you. A couple of more questions have come in. The next one is going to go to Marina Holtz, followed by Ronnie Myers, Ben Johnson, and Jerry Mather. The questioner would like to know from each of the deans, for how long do you anticipate that we're going to be staying away from in-person instruction? Can you give me any idea for your school about what the timeline might be when we get back to a majority of in-person instruction? So as I said, we'll start with Dean Holtz, then Myers, then Johnson, then Nadler. Dean Holtz, please.
Thank you, Dr. Halperin, for this important question. As we announced in the spring, we transitioned to the majority of our instruction online. And it is very important because it is crucial to minimize face-to-face interactions in order to halt the spread of this virus. That being said, we still have some instruction in person. Our clinical laboratory sciences program is conducting some in-person learning, and of course they do in-person clinical rotations. In addition to that, our PhD students are engaged in in-person research here on campus. For the rest of the classes, we're going to start this semester online, and we will reevaluate the situation after Labor Day when we see how the online instruction is progressing. And it is quite possible that we will continue the rest of the semester online as well, because it is important also not to disrupt the classes by rapidly transitioning to in-person learning as well, which will require huge modifications to our facilities. And frankly, our instructors are quite competent in delivering quality instruction online, and students like it as well. So as I said, we'll reevaluate the situation after Labor Day, but it's quite likely that we'll continue the rest of the semester online as well. Thank you.
Thank you, Dean Holtz. Let's go to the dental school for the answer to this question, their answer to this question. Dean Myers, please.
Thank you. So the question about occupancy becomes an interesting one. We've actually taken a phased approach, and starting back in June, when medical schools and dental schools could come back to the building, we started out with 16.5% of our students coming in for clinical care. And as far as simulation was concerned in the laboratory, which have to be done in person, we're at 25% of occupancy. Clinical care, as I mentioned when asked about our patients, is now up to 50%. And we have still one simulation course that's going on, and it is at 25%. Our plan at this point in time is to go after Labor Day to maintain the 50% in the clinical arena and go to 33% in the simulation laboratory. The online course presentation for our didactic program will continue. Obviously, everybody's question is, when can we go back to 100%? When can we go back to what was normal? I think we're dealing with the new normal. Obviously, there is a limit to the occupancy in the building right now. The governor has stated it's 50% in the building, and we will probably continue at 50% for the time being. Probably take us through the end of the semester with didactic program or didactic courses being entirely online. Nobody wants more than we do to get back to a clinical presentation of 100%. But again, I think that the disease and the pandemic will dictate much of that.
Thank you, Dean Myers. Dean Johnson for SHSP, please, your answer.
Well, we're clearly very interested in getting back to our normal teaching operations. We'll obviously be guided by safety issues. We're particularly concerned with our clinical programs because of the necessity for accreditations. So the speech language pathology and the physical therapy departments are looking at means by which they can safely provide those sorts of clinical experiences. With our public health, there are no similar sorts of clinical requirements, and so the ability to provide the necessary instruction to students can be done very effectively in an online format. As many of you know, we have fully online programs that we've delivered very effectively. I'm pleased to tell you that we've had very good success since we have gone to the online format back in March, and believe that we're doing a very effective job at delivering the courses. We're certainly hopeful that by the spring semester we'll be able to get back to normal operations, but as the previous deans have said, we'll be guided by the safety issues that are in place and a variety of other decisions that we'll need to make. Thank you.
Thank you. Now we'll go to the medical school for their answer to this question. Dean Nadler.
Well, thank you for the question. We're also guided by the safety guidelines and the community guidelines, as the other deans have said. Fortunately, our third and fourth year students are already in their clinical rotations with patients. The good news is that we're trying to keep them as safe as possible. The difference is that they are wearing appropriate protective PPE, whether that's N95 masks, goggles for their eyes, so that the hospitals are providing them, and in some cases we're helping to provide them. So our students will be continuing that way under the current timing. The first and second year students, for at least for this semester, will continue as we have been doing successfully, mostly online, except for specific courses and opportunities where we can do in person, again with spacing and PPE and hygiene. So that's, we don't anticipate any changes, at least through the semester. In the spring, as other deans have said, we'll keep an eye out to hopefully have a better situation and understanding so that we can maybe move more things to be in person at that stage. Thank you.
Thank you, Dean Adler. Our next question is for Sarah Cottet, and it is a variant of what was just asked about the students. Sarah, can you summarize where we are in reoccupancy planning? Will we continue to be running at a max of 50%? Sarah, since our dean spoke about the students, I think you should probably concentrate regarding faculty and staff occupancy in the building, please.
Thank you, Dr. Halperin. To follow up on what Dr. Myers said, the state limit is 50% population density, and that seems to be the new normal, at least for now. This allows us, operating at 50% is obviously in accordance to New York State requirements, but also allows us to provide the services that we are required to provide in terms of enhanced cleaning, attention to auditing health attestations, allowing for social distancing, particularly for those who have to be on campus to do their jobs, like animal husbandry staff, research staff, certain support staff, etc. So I would say that we are probably settled into this 50% occupancy for the near future. Obviously, as New York State guidance changes, we will take a look at what we're doing, but it's most important that we are secure in our abilities to maintain a safe workplace. So that will always be the driving factor. Thank you.
Thank you, Sarah. We're drawing near the close of our town hall meeting, but we've had another question come in, so we'll have this one be the last one. It's going to go to Nick Janiga. The questioner, Nick, would like a comment on what the status is of planning for the callback of currently furloughed individuals. Can you speak to that, please?
Yes, thanks. We have explained to people that we are continuing to review needs going on campus to ensure that we have staffing levels adequate, the needs of all of our programs. However, our next time that we anticipate making any longer term sessions or changes would be after Labor Day in mid-September. Not a guarantee that that's a timing of when people will be coming back, but the next time we'll be evaluating any type of significant move from the current furlough list. Thank you.
Thank you, Nick. We had set ourselves the task of having the town hall meeting, answering your questions and taking about an hour to an hour and 15 minutes. It is now 3:15 and we've answered a dozen questions or no more in the question and answer box, and we've met our time constraints. So thanks everyone for joining us for the town hall meeting. Everyone stay safe, take good care of yourselves and your families. We'll keep the lines of communication open. Have a good afternoon, everyone.